And I now call Karen Adam, who will be the last speaker in the open debate. Up to 6 minutes, please, Ms Adam.
Thank you, Presiding Officer. And I'm pleased to have the opportunity to speak on this motion today. And I just want to caveat that everything that I will be outlining, it really has hard-working staff behind it, and I really want to acknowledge them and everything they did through the COVID pandemic. Since forming government, the SNP have built a strong record to deliver high standards of care across the country, and this is driven by our ethos of compassion, dignity and respect, and that is at the centre of everything when it comes to health and social care. This was firmly outlined when Shona Robson brought forward the new health and social care standards in Scotland in 2017. Traditionally, health and social care has seen those requiring support often taken out of their homes and placed in unfamiliar settings. However, as we have moved forward with the integration of health and social care, we have ensured that person-centred care and support is at the heart of everything we do, which has seen an increase of more people being able to receive support in the comfort of their own home. By doing this, we are continuing to improve outcomes for people who require care while utilising the best technology that we also have access to. By scaling up our services with the £1 billion NHS recovery plan, we can tackle the pressures on our NHS by providing general practices and their patients with support from a range of healthcare professionals in the community, and recruiting 1,500 more staff over the next 5 years for our national treatment centres, alongside 1,000 community mental health staff. Increasing primary care investment by over 25% to support GPs, dentists and pharmacists. Investing over £400 million to create a network of 10 national treatment centres across Scotland. I was really pleased to see record investment from the Scottish Government across our health and social care sector, with £18 billion of funding going to fund health and social care. And this is going to go a long way in supporting people get access to the care they need, while ensuring carers working in the sector are paid more. And that is a key aspect which underpins this service. Investment in our services and our population is key to Scotland's recovery from the pandemic. More than ever, we realise the fragility of our mental health as well as our physical. In part of my own constituency, the Health and Social Care Partnership in Aberdeenshire has moved progressively to develop a hospital-at-home policy. There was recognition within the Health and Social Care Partnership that they had an ageing population, and in order to have a system that supported the delivery of a long-term sustainable service, so a fundamental shift in thinking was required, progressive thinking. The opportunity to develop a hospital-at-home service presented itself when NHS Grampian undertook a whole system redesign, including transfer of resource from acute to community. This change meant that the acute geriatricians could be aligned to managing patients within the community. Alongside this redesign was the acknowledgement that, wherever possible, our population is better served when we receive care in our communities, which has been at the forefront of the Government's record in health and social care. Before Hospital at Home, there were already various community models in place in Aberdeenshire, including community hospitals, virtual community wards and a multidisciplinary approach, meaning the concept of managing patients within the community was already well established in the Health and Social Care Partnership. Hospital at Home was the next logical step. Within the context of our response to COVID-19, we have benefited from the strong relationships with local authorities and the NHS. This enabled a swift, cohesive response, ensuring that our residents and staff have the protections and supports they need to stay safe. Operation Home First, as it is known, became the next phase in the health and social care response to COVID-19 across Grampian, involving all 3 health and social care partnerships and the acute sector, and harnessing the strong collaborative working and whole systems approach which was adopted across all sectors during the response phase. This innovative and person-first principle, where place-based care was of paramount importance, embodies a framework within which we can create the right environment for keeping people at home safely, reducing hospital admissions where an alternative intervention is possible, and making sure that people who do need care in hospital do not need to stay in hospital longer. A key focus in directing support towards prevention and an increased community focus to improve outcomes for all, and not least elderly people. This prioritises a goal of home first for all care, ensuring the system remains flexible and agile to respond to any surges in demand, and considering the whole person, their circumstances and supports. The model of best practice can be reflected across Scotland within a national service. In conclusion, Presiding Officer, I'm sure I'm not the only carer in this chamber or person to experience a loved one receive care. In this respect, I say that choice is an absolute necessity. The option to stay at home must be a right, and to many people there is no place like home. And that sentiment I am glad to see embedded in policy for a progressive approach to healthcare for all. Thank you.
Thank you, Ms.